Hey, I'm Dr. Joseph Yaker, and as a double board certified hair loss specialist, I'm here to talk to you about supplements. We have to understand that supplements are not FDA approved. The FDA treats supplements more as food and not drugs. So pre-market claims and the way that they're produced or the quality of production is always going to be on the manufacturer themselves. When you're looking for any supplement, you always want to make sure that they're third-party certified. That way you know that what it says on the label is actually inside your bottles. The two third-party companies that I will recommend is USP or United States Pharmacopeia or NSF. NSF tends to do more sports-related supplements, but you can't go wrong as long as you see the USP or the NSF symbol. So I'm going to read a quick subreddit question regarding biotin. It's something that I get asked often, and a significant number of our patients are already on it. So let's give you a little bit of background on biotin. Biotin is vitamin B7. It's often marketed as biotin, so people don't realize it's part of the B family. We also need to know where biotin is made. Biotin is actually made in the friendly bacteria in our gut. It's found in healthy foods. And the amount we actually need in a day is very, very low. The chances of being biotin deficient in the United States is so low because we eat rather well. When we take biotin, which is usually in a multivitamin, and then someone takes hair, skin, and nails, and then someone takes additional biotin, we have to remember, A, that supplements are not innocent. They can lead to toxicity levels. And B, you can only consume so much. So if you have normal biotin levels and you keep consuming all this biotin, it's doing you no good. There also is this theory that if I have hair thinning, therefore I must have biotin deficient and I need to supplement. That is incorrect. Like most diseases or deficiencies, there's usually a laundry list of possible side effects. It doesn't mean guaranteed side effects. So while biotin deficiency can possibly lead to hair thinning, it doesn't mean that everyone with biotin deficiency will. The other issues with biotin is that it can cause acne breakouts, it can cause digestive issues, but more importantly, it can affect certain lab tests. When people go in for lab testing, they need to know that biotin can affect certain markers. For example, if you're taking biotin and you get your thyroid tested, your sugar tested, your heart attack marker or troponin tested, or even vitamin D and testosterone tested, it can actually throw off what your real lab value is. So I encourage everyone to put down the biotin. You're getting plenty of it from food. If you're taking a multivitamin, it's already in there. But also remember, if you are taking a biotin supplement, you want to stop it anywhere from 3 to 7 days before you go in for any lab testing to ensure that the lab results are real. When I do a full chart review of a patient, I do notice that patients are typically on a number of supplements. We have to really remember what the definition of a supplement is. A supplement is assistant. You need an assistant if you actually have a deficiency or if you're low normal. If your blood work shows that your vitamins and minerals are normal, that is because we typically get the majority of our vitamins and minerals from our diet. The biggest concerns that I see is that people take multiple supplements that actually have the same thing. For example, people will take a multivitamin and Nutrafol, which have a lot of the same things in them, and then they're also getting their vitamins and minerals from diets. So when I check their labs, we often see liver injury, but more commonly, we're actually seeing toxicity levels of certain vitamins and minerals. So we have to remember we first need to test, and if there is a true deficiency or there are certain labs that are low normal, that is when we can supplement. But we also have to remember that many supplements have different dosages. Once you start any supplement, you need to retest that lab work again 2 months later to make sure that the dosage is actually proper one, but it also may be a little too much. So getting blood work every time you make a move, whether it's adding or subtracting a supplement or adjusting the dosage, we need to get blood work 2 months later. 3 treatments I would never do as a hair loss specialist are biotin, Nutrafol, and rosemary oil. With biotin or vitamin B7, this is something that has been passed down from generation to generation, that there's a correlation between hair loss and low biotin. That is actually not the case. It's very rare for us in this country to have a biotin deficiency. We also have to remember that biotin is proven for someone who has brittle nails. If someone needs better nail health or nail growth, that actually has science behind it. But after all these decades of people assuming the biotin actually helps hair, there really isn't any clinical evidence. So that is something that we should throw in the trash. The second thing is Nutrafol. Nutrafol has done an amazing job with their branding and their packaging, but we also need to know that it is a supplement. Supplements are not regulated by the FDA. What that means is the FDA treats every supplement as food and not as a drug. So all pre-market claims and all quality control testing are performed by the company themselves. When we actually know how to read labels and we look at Nutrafol, it does have a slew of vitamins and minerals, and then they claim to have a proprietary blend formula. To me, that's pretty shady when they're not telling us what that proprietary blend is. And the other issue is, since there's no quality control, there is a risk that the dosages will be off. For example, if I bought 3 bottles of any supplement, not just Nutrafol, and I got them tested, there is a very good chance that the actual dosage of each ingredient is going to be different from bottle to bottle. And what I see more times in a week that makes me frightened about using this supplement is that a lot of men and women end up having vitamin and mineral toxicities. So if you're taking Nutrafol and you're getting your vitamins and minerals from food and you're taking a multivitamin, your toxicity levels of certain minerals can go up as well as vitamins. What I often see with Nutrafol by itself is selenium. Selenium is an element that we do need for hair, but there's a fine line. If we go too high, it can actually cause stress-induced shedding. So everybody that comes to my office, I always check a selenium level. And what seems to be very, very common is that when someone is on Nutrafol, their selenium levels are quite high. The third thing is when we talk about biotin and Nutrafol, if you don't have a vitamin deficiency, you don't need a supplement. Supplements are assistants. So the first step should be go to a qualified doctor, see what your cause of hair loss is, and if they're checking your vitamins and minerals and you have deficiencies, you buy the supplement that is specific to the deficiency you have instead of buying these multivitamins. Lastly, I'm not a big fan of rosemary oil today. My opinion may change in the future, but we should never base effectiveness of a treatment based on one study with a small subset of patients. The study was 100 patients, 50 were using rosemary oil twice a day, 50 patients were using the lowest dose minoxidil, which is 2%, and the study only lasted 6 months. That to me does not give me enough evidence to say that that study proves that rosemary oil is at the same level of minoxidil, especially 5% minoxidil. So those are the 3 that I would never touch.